There are many things in our environment that we are exposed to that essentially put chinks in our body's armor. And these barriers have unfortunately become a little more leaky or permeable. They allow more things in. Fragrance is one of the number one contact allergens that we're exposed to.
What is Sjogrens and why is it not being diagnosed? Autoimmune diseases and allergies are no longer rare. They're becoming the norm. Over the past few decades, autoimmune conditions have increased by more than 300%, and allergies are now affecting over 1 in 3 people worldwide. In children, allergy rates have tripled in a single generation. What used to be seasonal reactions are now triggered by foods, fragrances, stress, heat, light, and even everyday environments. And then there's Sjogrens, a condition that is often dismissed as just dry eyes or just dry mouth. However, it affects over 4 million people, primarily women, and is one of the most underdiagnosed systemic autoimmune diseases. Why is the immune system reacting more aggressively to a world it once tolerated? Welcome to the Uncover Your Eyes podcast. I'm your host, Dr. Meenal Agarwal. If you haven't already hit the follow or subscribe button, please do so. Let us know you're listening. It helps us bring you better episodes weekly. Today, I'm joined by Dr. Kara Wada, who is board certified in allergy and immunology and brings a different perspective to immune reactions, allergies, and autoimmune conditions like Sjogrens. Thanks so much, Kara, for being on today.
I am so excited for this conversation. I've been looking forward to it for the last few weeks.
Oh, no, thank you. So tell me why, it's always like a worry of mine with my kids. Why are allergies, autoimmune conditions for kids and adults on the rise, skyrocketing rates?
Yeah, so it is this perfect storm of things that have come together. And this is really what we've come to understand that there are many things in our environment that we are exposed to that essentially put chinks in our body's armor. So our body consists of our skin, our respiratory tract, and our gut are all of the ways that our body interacts with our outside world. There are barriers, and these barriers have unfortunately become a little more leaky or permeable. They allow more things in. What we also know is when these barriers get more leaky or more permeable, that the microbes or the bugs, viruses, fungi, other little critters that live in us and on us, the amount of those different bugs, the variety, and the behavior of them is different on barriers that are leaky versus that are not. So we don't know if it's the chicken or the egg that's driving that, but we know those things go together. And if you have this barrier that's got more holes in it and a microbiome that looks a little different, our immune system and our nervous system, for that matter, on the inside is receiving different data than it normally would. Different signals from those microbes, seeing more of the lotions and potions we put on our skin, or the pollen, or detergents. Think about a kiddo with eczema. It's the definition of leaky skin. And it's inflamed, it's itchy, it can be dry. Sometimes it can be weepy. When we swab that skin, we'll see more staph bugs and more of the Staph aureus, than what would be typically there. That Staph aureus sometimes secretes more toxin. That's how they sometimes behave differently. And our immune system sees that data, it sees other things that it's seeing, the lotions we're putting on, the pollen or the fabric softener, dryer sheets, right? The body sees that. It's able to make an immune response to those things. And there's one other element that we're still trying to understand a bit more, but we know that if there's inflammation that's there or the immune system's dysregulated, that often our metabolism, our body's ability to make energy, like ATP, it's our body's currency or money, so to speak, we're not as effective or efficient in our ability to create that ATP. So we think that that plays a role to some degree too, although that part, it's venturing a little bit out of my allergy immunology realm, but I'm very interested to learn more about that. As we all as a field continue to learn, but all of these elements come together as this perfect storm that our body's seeing more of our environment than it used to.
So why are like I guess
Yeah,
for person's perspective, why is the skin becoming more leaky or the
yeah,
body becoming
or
more
this
leaky
leaky
gut?
gut thing,
Yeah.
all this, right? So a lot of the things that are part of our everyday modern world chip away at our barriers and some of those natural protecting factors that we have. We have really great soaps, right, that we are able to use in the bath, on our clothes. And it's wonderful because it certainly helps keep us clean and smelling nice, right? And our clothes smelling nice. But they also, for some folks, if that barrier is more sensitive, be a little too much. We love nice smelling things. We know fragrance is one of the number one contact allergens that we're exposed to. When we think about the food we eat and the water we drink, I was talking to a patient this week. She lives in an area where unfortunately there's high lead levels in her drinking water, public drinking water. So she's been drinking bottled water. That's all she's been drinking for months on end. And she's like, oh my gosh, Dr. Wada, I didn't even think about microplastics. This wasn't a thing. I don't know about you, but I didn't learn about microplastics in
Mhm.
medical school. But we're now realizing we end up ingesting about a credit card's worth of plastic. I think every week is the statistic I've heard. We tend to eat a diet that is lower in fiber on the whole, and fiber actually helps one feed the healthy or the beneficial microbes. They also tend to then create a lining of mucus over the lining of our gut. And that mucus is protective. It helps feed those microbes, helps keep them happy. And when they're happy and well fed, they create more anti inflammatory chemicals called short chain fatty acids. We also, the air we breathe, unfortunately, there was a Jon Stewart when he was on the Daily Show. So this is many years ago. He did a piece that had me in stitches, but making fun of how the news is always sensationalizing pollen season. The pollen count, it's pollen tsunami, it's the worst season ever. The reality is, if you look at the data over the last 10 or 20 years, it really does keep increasing. And so we are seeing higher pollen counts on the whole than we've ever seen. So pollen not only creates allergy, but it's also particulate. It's irritating. Depending on where we live, air quality may or may not be all that great based on traffic and emissions and those sorts of things. So all of these, kind of add up, chipping away over time, and very likely over the last several generations. Think about I think about how the diet I grew up on was definitely different than the diet my mom and dad grew up on. Very different than the diet my grandma and grandpas grew up on, and they're
Yeah.
relatives too.
So, I mean, you mentioned a lot of these soaps, detergents.
Yeah.
Like again, layperson, I'm like, really? How could it be that? Right? So like how important is it for us to be changing those to more net like
Oh,
even your
great question.
detergent? Like sometimes I'm like, is it really worth it? Like, does it really do anything? How
Hmm.
important is this, for our children and the future generation if is it really going to help eczema and the or allergies?
Yeah.
Allergy
So
development, I should
I
say.
think one thing is knowing kind of your family history. So, family history does play a pretty significant role, not the only thing, but definitely plays a significant role. So, if you know that your mom or your grandma, your grandpa, or your dad, siblings have had a tendency towards allergy, whether it's seasonal allergies or asthma, drug allergies, I think that, that's a little, piece of information you file away. Okay, well, my kiddos might be at a little bit higher risk. Other things that I think about, how are things during that first part of life? The reality is that, in a perfect world, if every baby could be born vaginally and if every baby didn't need antibiotics, like, yes, that would be great. Kumbaya. And also, those interventions of C-section and antibiotics have helped so many babies live through those critical first month, days and months and years of their lives. And so, if able, trying to minimize those interventions, but not at the, you know, don't throw the baby out with the bathwater, so to speak. I think, one of the other big things that gosh, I'm struggling with personally. My middle, she is my one that history of an egg allergy, which I'm so grateful that she ended up outgrowing. But gosh, if that kiddo could live off of a processed carbohydrate and cheese, that's what she would live off of: mac and cheese, cheese pizza, grilled cheese sandwich, right? And frankly, I know where she got it from because I would have been very happy living off of that in second grade. And I probably did to some degree. But if you think about, that's not necessarily not very diverse, does not have a lot of fiber, not a lot of color of the rainbow. So, one of the things that I would, share with families to prioritize: one, just allowing for and trying to encourage some of that diversity in the color, and making those things available, and also not totally stressing about it. And then making small swaps. So if you are someone who does have a higher risk, or you have a baby who's had a history of some mild eczema, well, gosh, like, an easy thing to do is just to switch to the fragrance free version of whatever detergent you like. And that may be quite helpful. Or switching out the dryer sheets to the wool balls. Now, are you going to have some static? You're going to have some static, and it'll be okay. But those are some really simple things that, and frankly, making that switch to the wool balls is going to save you some money over the long term too. And really encouraging kiddos to the best of your ability to eat some veggies, eat some fruits, and to play outside. We know that playing outside, getting dirty, then coming in and using some soap and water, to wash those things off, but that those are protective.
So I'm assuming these are the same, causes, the leaky skin, leaky gut for autoimmune conditions, allergies kind of
Yeah,
go hand in hand.
yeah.
So, um, I want to talk about stress, and how that plays a role for autoimmune conditions. Like, is there a pathway such that stress could even just kickstart an autoimmune condition?
So that's where, I really, when we talk about that perfect storm, I always like to mention, along with the immune system, the nervous system, because that absolutely is playing a critical role. And frankly, as someone who is not a neurologist, so you got it brushed off for quite a while. But absolutely, we do know that if you are, the reality is that we do see a correlation between folks who have high levels of what are called adverse childhood events, or these ACE score. These events that happen early in childhood that we know are traumatic. Things like a parent with substance abuse, or a parent who's dealt with incarceration, death of a parent, abuse of, all the different types, bullying often is grouped in there. That exposure to those experiences, and the more of those experiences that someone has dealt with, does increase the risk of later in life developing autoimmune conditions and other chronic inflammatory conditions as well. It's not uncommon, though, not everyone has this experience, but that someone may experience a car accident, or, some other either physical or emotional trauma, and that tips things over kind of check the boxes and say, oh, yes, now we've hit diagnostic criteria for a particular autoimmune condition.
I'm going to shift to Sjogrens because,
Yeah.
I was really happy to learn that that was something that you really focus on for the eyes. I mean, the dry eyes and the dry mouth, that's, one of some of the classic symptoms of it. And I know that people go undiagnosed with Sjogrens for 6 to 10 years, as a
Yeah.
stat. And there's a lot of patients that I see where, I'm like, they say to me, they've been suffering from severe dry eyes for many, many, many years. And, I'll see them and I'll be like, you ever thought about Sjogrens? And they're like, what? So can we talk?
What, can you spell that for me?
Yeah.
What is that? Say that
So can we
again.
talk about what is Sjogrens
Yeah.
and why is it not being diagnosed?
Yeah. So Sjogren's is a systemic autoimmune condition. It, for many years, was known as Sjogren's syndrome and recently had a name change where now the official term is Sjogren's disease, just within the last 18 months or so. It is actually one of the most common autoimmune diseases, but it's also one of the ones that, gosh, it seems like it's really hard for patients to actually get that diagnosis. And I have an interesting perspective in part. I and part of how I ended up coming to care for a lot of patients with Sjogren's was through my own diagnosis back in 2019. And what I realized was, one, when I started talking with fellow patients, when I learned a whole heck of a lot more than I ever learned to pass my PEDS boards, to pass my internal medicine boards, to pass my immunology boards, even. Um, and as they started sharing with me some of these other symptoms that went along with that very classic dry eye, dry mouth, and I looked backwards, I thought, well, heck, I think I had symptoms even back to college, just 10 plus years before my diagnosis. And it really was my dental hygienist. I went in for a cleaning and she said, well, gosh, your mouth looks really dry. And it was kind of that objective comment that made me think, well, I haven't been able to wear mascara for several years because I tend to look like a raccoon if I do. Um, and I've been profoundly tired, a lot of body pain. And frankly, I was just back to work after having my second child. And I attributed a lot of that fatigue to some professional burnout and frankly just being a doctor mom of two. It was my second year as an attending, like it kind of try to brush things
Yeah.
off. um, 30 to 40% of folks with Sjogren's have normal blood work, and I think that is one statistic that, although it's very likely taught, along the way, in our current medical system, especially US based medical system, we have very short visit times. And if you have a patient who comes in with Sjogren's, if you look at kind of what folks often will lead with in those visits, it's fatigue and pain. So if you have a 15-minute visit and you're a doc who's already running behind and you have a patient who, gosh, just looks, you can just tell they feel terrible, they're tired and fatigued. I think for a lot of docs, that's like, oh gosh, I don't want to go there because I know I'm going to end up in this room for an hour and I'm already 30 minutes behind, right? Like, I think that there isn't always a system that's set up to allow for that. Hey, I hear that you're really tired and you hurt. Asking about dry eyes and dry mouth probably is not the first
Top of their,
question, right? Want to
they
think
might
about
even go
anemia,
towards like
think about
thyroid
vitamin
or
D,
anemia.
thyroid, yeah, all
Yeah.
these things,
Yeah.
depression, right? Are you just anxious, right? Especially as women, Sjogren's, 90% of patients with Sjogren's are women. It can affect, all genders. It can affect all ages, pediatrics, onwards. And also, I think, there's an impression, although it is one of the most common autoimmune conditions, that it's rare. And so one of the things that many of us in the community will say, it's not rare, it's just rarely diagnosed. Um, folks may not think they may grab an ANA, but they may not grab the SSA, SSB. And again, if that's normal and all that's normal, often they're getting that high five, like, oh, you're fine, labs are good, I don't know, and sent on their way. And that happens a couple times. And then as a patient, you're not super willing to put yourself out there, right? And
Yeah.
so what I often will hear in the stories from my patients is that, they tried getting help, didn't find someone that, was able to help them at that point. They often will go outside of kind of the traditional system for a period of time, many times maybe diagnosed with yeast overgrowth or candida, maybe diagnosed with chronic fatigue or adrenal fatigue, some of these diagnoses that are a little vague and not quite, um, and we'll try various things. And then eventually we'll end up back in the system. And what makes me so sad is that you've lost a lot of time. And what we're starting to see, so I think one of the other frustrations within Sjogrens is, as of today, when we're recording this mid-January of 2026, there are no FDA-approved medications for Sjogrens. My hope and what it looks like is that by the end of 2026, we very well will have our very first FDA-approved medication. There's multiple drugs in the pipeline, super exciting. And I've been fortunate enough to be on a study drug for the last year and a half. And what we're starting to see from this early data coming out from these phase 2 trials and early phase 3 trials is that those who have gotten treatment within that first 8 or so years of diagnosis, they're responding better. They're having more saliva production. They're having more tears. They're getting more benefit from the medication. And my guess is they've had less time for that ongoing inflammatory damage that just adds up.
Can I ask you, I want to go back to the symptoms
Yeah.
because what are the classic symptoms? You mentioned the fatigue and the dry eyes and dry mouth. Are there other symptoms that are
Mhm.
very common that you're
Yes.
seeing?
Yeah, one of my colleagues who also has Sjogrens, and gosh, she runs a website called Sjogrens Advocate, and that is an understatement for what she's done, Dr. Sarah Schaefer. And I'm going to paraphrase, so I'm not going to. I'm sure I'm not going to get her quote quite right. But you often will hear, if you allow a patient with Sjogrens the time and space to share all the things that they recognize from a symptom standpoint is not like normal, um, it's a lot. And it has you going like, how can so many things be wrong with one person?
Hmm.
And you can kind of hear and see how that, like, often within the medical and in just like our culture, right, that like, oh, it's just a hypochondriac, someone who's worrying too much about their health. But it's a very systemic disease. So there often is body pain that feels and looks a lot like fibromyalgia, um, which we think is very likely related to some small fiber neuropathy that Sjogren's very often will affect the nervous system. And there are some statistics out there, but I think there very likely are some gaps in how that's measured, because often you will hear folks say, "God, my thinking is cloudy or foggy. I can't concentrate as well. I'm having trouble remembering words." And though have a history of headaches, really common migraine and other headache conditions. Um, with the dry mouth, and also probably related to some of the nervous system input, sometimes can have difficulty or with swallowing, esophageal spasm, irritable bowel type symptoms, constipation and or diarrhea, sometimes a combo of both. Can have elements of arthritis. Usually it's not as destructive as like a rheumatoid arthritis, although autoimmune diseases like to travel in packs. So just because you have Sjogren's doesn't mean you don't have RA or lupus or other conditions. And for many years, Sjogren's would actually be classified, if it was on its own, it was considered primary. If it was grouped with something else, it was secondary. And that terminology has kind of been thrown out. I like to say product of like, the 80s, 90s of like, nobody's going to put baby in the corner. Like Sjogrens is Sjogrens, it's not secondary to anything. It's its own thing. Dysautonomia is, it's a long word, gosh, but it's increasingly recognized in part because of long COVID. So, dysautonomia is an umbrella term that that's describing the autonomic or automatic nervous system not functioning normally. And so that can show up in a whole host of ways, but Sjogren's is the number one autoimmune cause of those issues with the nervous system. So that could be temperature intolerance. So I often will ask folks like, "Hey, have you noticed any difference or changes in your sweating?" And it's not uncommon to say, "Yeah, like a few years ago, I just stopped sweating," or "Yeah, a few years ago, I just started drenching sweat. Like this is so weird." POTS is one of the most commonly recognized and talked about types of dysautonomia. Postural orthostatic tachycardia syndrome. Essentially, blood pressure, heart rate are not talking with one another and not coordinating well. I have an element of orthostatic intolerance. So if I'm not well hydrated, or if it's a hot day, if I've been sitting or laying down, I have to be a little more conscientious of
Mhm.
popping up, because I'll tend to get a little dizzy and have to kind of steady myself. I had an opportunity to be a guinea pig with a health wearable at a conference, and it was measuring blood flow to the brain. It sits in the ear. They've renamed it. I can't remember the name of it now. They essentially tracked my orthostatic vitals. So they had
Yeah.
me lay down with it in, they had me sit up, they had me stand up. And when I stood up, I had to stay still. And what I realized was that felt super uncomfortable. And I didn't realize this until I like had, kind of was this guinea pig, that I never stand still. I assumed it was leftover from when I was pregnant. I would always, sway side to side, or after I had the baby, like, and having had babies and pregnancies for the last, 10-ish years, I just thought that that had become like a behavioral quirk, that stuck around until I had to stand still. And I watched on the tracing the blood flow or the blood pressure to my brain come down as I was standing still. So
Wow.
I think, it is like, at least it's like peeling back the layers of an onion
Yeah.
when
Yeah.
you talk with patients. Vaginal dryness is also another really big problem that, think about dryness in the eyes and the mouth, another dryness in the nose, frequent sinus infections, or allergy symptoms are real common too. Um, and skin rashes. And then there, one of the things I was told by a dear colleague, and she's a good friend, and I know she meant no harm in saying this, but now I do cringe as I think that. She's like, "Well, gosh, Kara, like of all the autoimmune diseases you could have," because she helped with my diagnosis, she's like, "Sjogren's is like, tends to not be as serious." And I cringe because that's not what the data shows. It's not what the lived experience shows. And there are, real complications. So the things I think many of us that live with it and care for those patients worry about: interstitial lung disease can affect a portion of patients, which can show up many different ways. And then there's about a 10% lifetime risk of lymphoma. Now, granted, of the lymphomas, they do tend to be, on the milder end, but, anytime that anyone says, "Gosh, you have a 10% risk of cancer in your lifetime," you're like, "Well, that gets my attention." And then increased risks of cardiovascular disease. So we know Sjogren's does have elements of that metabolism difference, where our lipid panels tend to have some changes. We're a little higher risk, increased risk of heart attack, stroke, those sorts of things too, which, so I'm married to a cardiologist, that
Oh,
comes up in conversation. Not all the time, but it has, of course.
I
Um,
want to ask you about the blood work. You mentioned the names of the panel,
mhm.
the markers that we're looking for. What markers are we looking for in the demographic that does test
Yeah.
positive?
So often, I will check for an ANA, which is often termed the lupus test.
Okay.
Sometimes mildly positive ANA may be the only kind of clue, along with the symptoms. The more specific antibodies that are kind of those ones that you get tested on your boards are SSA and SSB. And primarily SSA is the one that is part of the diagnostic criteria, or rather the classification criteria. So with Sjogren's, they're often, and I think this goes back to why it's hard to get a diagnosis. There's a set of criteria called the classification criteria. Those are the criteria someone has to meet in order to be a part of a study for Sjogren's. And they are a bit more rigid. They're trying to make sure everyone in that group absolutely, totally for sure has Sjogren's. And so it's a scoring system. And what you need for that is you need to have an SSA positive, or you need to have a lip biopsy that has a certain amount of inflammation, a certain type of inflammation. It is scored, a focus score is what it's called. You have to have a focus score of 1 or higher, along with objective findings of dry eye. So Schirmer's test or other tools in your toolbox to say, yep, dry eye. And technically a salivary flow test that would say, yep, you're making less saliva than you should. So many rheumatologists often are the docs that tend to be kind of pushed, the responsibility of diagnosis has been pushed to them. And I think one of my goals in this is to encourage other primary care docs, fellow allergy immunology docs, ophthalmologists, empower you to feel more comfortable, with this diagnostic process. That if you have someone that, gosh, you hear this and you're like, looks like a duck, quacks like a duck, that you're thinking about this. There's another panel that I do use with patients, with some discussion. There's something called an early Sjogren's profile. It is not part of the diagnostic criteria. There are many docs who will not recognize it or use it. It looks for 3 different antibodies, different from the SSA and SSB, that are antibodies against proteins that create saliva and create tears. So there's a salivary protein, carbonic anhydrase, and one other that I can never remember. And it's looking for several different types of antibody proteins that can be made to each of those. So it's actually 9 tests altogether. And so often if a patient is like, well, we'll talk, it sounds like this may very well may be what's going on. You have dysautonomia, you have fatigue and body pain, and there's some dryness, but your labs look normal. And understandably, a lot of patients are not super thrilled with the idea of having a lip biopsy. Now, I'll say lip biopsy, it's not super involved. It is an office procedure. They usually use some local numbing. But there is about 20% of patients will have a false negative lip biopsy. So it's not a slam dunk. Not a lot of docs do them very often. So although it's easy, like I absolutely will see pathology reports that will say scant tissue, meaning they did the biopsy, but they didn't get much of the actual gland to look at under the microscope. And so it's not a good sample. You can't really, get up one of those focus scores on there. And so in a lot of folks have had not great run-ins with the medical system. So they're not thrilled with the idea of more visits and so forth. So often I'll say, well, let's check this other lab work. And, or, currently the treatment we will tend to offer to patients is something called hydroxychloroquine. And I'll say, well, hey, we can check this lab, and, or we could try 6 months of hydroxychloroquine. Here are the risks and potential benefits of that, and see where we're at, and kind of go from there.
And what is the difference between, you said there's no medication that's specific to Sjogren's at
Mhm.
this time, but, we have been using hydroxychloroquine and
Yeah,
other, immunosuppressants or,
yeah.
anti-inflammatory drugs. So what is the difference now? What are we trying to
Mhm.
target specifically with these Sjogren's medications?
Yeah. So, a quick little word: hydroxychloroquine is an old anti-malarial. It's relatively gentle in regards to kind of it doesn't suppress the immune system; it just modulates it and turns things down. Does require some follow up with your eye eye doctor to make sure, rare, but there are some potential complications there. Generally well tolerated. It can help most with fatigue and body pain, and also can help with some of the joint, arthritis symptoms. It hasn't been proven to be that helpful with the dryness. So I think that's, a frustration. The medications that are in trial, there are, oh gosh, there are a lot. And I'm so excited, and I'm filled with hope, for the future for our patients. The medication that I've been on trial is called dazodalibep. It is a fusion protein that essentially interrupts communication between T cells and B cells through something called CD40 ligand. It's one of the receptor, like, little ways those cells communicate with one another. Practically speaking, that for me, that shows up as a 90-minute infusion, once a month, and has gone pretty well. I haven't had much in the way of side effects, and have had, at least subjectively speaking, improvement in my dryness, except for when my kiddos bring home, and I'm going to rub my eye on cue, when my kiddos bring home their viral crud, which increases some of those, chemical mediators, and flares things up a bit. My 4-year-old's home with a fever today.
Oh, yeah.
It's been the season. There's a medication that, Novartis has in trial called inalumab. It is very likely to be the one that's first approved. They presented some data at the American College of Rheumatology this past fall. It works on, B cell receptors, so it works a little bit like rituximab and a little bit like Benlysta, which are some meds that are approved, for, some other rheumatologic conditions. And that's the one that I mentioned, that data showed that folks who were, relatively newer diagnosed, folks, they tended to respond, a bit better, especially when it came to, saliva and tear, production and recovery of some of that. The other one that is, on the launching pad is called nipocalimab. It helps actually prevent the body from recycling antibody through something called the neonatal receptor antibody. That medication is already approved for a different autoimmune condition called myasthenia gravis, and is used for that. There's a sister medication, called, efgartigimod, which is also approved for myasthenia, works on the same mechanism, and that's in trials too. There's one other that is still in very early, like just finishing up phase 1 trials, that I'm just like, the immunologist in me like nerds out about. It's, called CLN978. It is, a T cell engager. Hopefully I'm getting this all right from memory. It's similar to CAR T in that it targets, the B cells that are creating the autoantibodies and kind of takes them out. But it doesn't require, in CAR T, what happens is, a patient goes in, they essentially, freeze off or pull off their white blood cells, and they put them through a reprogramming process, and then they infuse those cells back in.
Mm.
You can imagine that is a very expensive process, hundreds of thousands of dollars. So this CLN 978, what's different about it is it works on a similar way, but it's an off the shelf treatment. So it doesn't require kind of that bespoke personalized reprogramming, to do kind of a similar type process. So,
Interesting.
I'm kind of nerding out because, gosh, if you could take out, kind of like an assassin, take out the autoreactive cells, leave the other parts of the system intact to continue to fight off infection or the colds your kids bring home or whatever, like that sure as heck sounds great.
Yeah. Wow.
Yeah.
So, if, before people head to medications, are there 3 things or a few things that you tell every patient to do?
Hmm. I think first and foremost is to advocate for yourself. Like, the medical system is really challenging, right? You have limited time in front of your physician. I think it can really be a huge benefit to spend 10 or 15 minutes before an appointment and really think about what you need to get ideally from that appointment.
Mm-hmm.
I mean, one quick little thing, when you're calling to schedule an appointment, you may ask the scheduler, like, hey, about how long are Dr. So-and-so's appointments scheduled for? And do they double book? So that will kind of give you an idea, or, of like about how much time you may have like in front of them. So I think that can be really helpful, and having an ability, like one of the things I've realized in the patient role is I will go into kind of more of a stress response in the visit. I see a different rheumatologist now, not because I'm mad at my friend for what she said. Her role changed,
Oh
and
gosh, this
insurance
podcast
changed
is
and
going to
so forth.
create issues
Yeah,
now.
no, we're good. But she is honestly one of the sweetest humans on the planet, and I totally have a fawn response when she's like, how's it going? I've been fine. And then I leave the appointment. I'm like, I haven't been fine. This is pre-trial, but like, I've been like really tired or really dry, like whatever. And so I think like knowing those tendencies and getting to know yourself can be helpful too, so that, or having someone go with you so they can call you out on that can be
Yeah.
helpful.
Yeah. That's huge.
I think there's this balance between, and I'm still working through this, like this identity, right? Of like, I now have this identity of someone who lives with chronic illness, and trying to find this balance between, it is part of me, but it is not driving. It's not driving the bus. It's not all of me. Finding some space and community where I can connect with others who are walking a similar journey, and also not getting sucked into some of these spaces in the internets that are very negative and like, I hate to say the term, but like suffering Olympics. Like there are some spaces where folks will start comparing like who has it worse, and that doesn't serve anyone. It doesn't, like, suffering is suffering. And then as far as like lifestyle stuff, start trying to make some of those like safer swaps, getting rid of fragrance. If you have sensitive airway, minimizing the candles, get rid of the plugins. They're I hate to use the word toxic, but they kind of are. Thinking about an air purifier if you're someone who does have, especially, pet allergies, you have pets at home. Take your time. Rome wasn't built in the day. It's like one of the those sayings that will never escape, but it's true. And those small changes over time, they add up considerably. We just are launching a workout program called Stronger with Sjogrens, and we were talking before we hit record. I was trying to demo this on YouTube, which was comical, but some of the comments in the chat were like, gosh, I don't know if I can do 10 minutes. And I get down on myself for not showing up even for 2 minutes, or just making the effort to show up for yourself in one way, shape, or form, whether it's movement or prioritizing a nourishing meal, or carving out some time for self-care, which is not necessarily a mani-pedi, but just time and space to process your emotions, or to do a self-compassion exercise. Like those things add up over time and really can help you go the distance, because it's a marathon, not a sprint.
Absolutely. I love that. Thank you so much, Dr. Kara. Thank you for your time today. I mean, that was super helpful for our listeners. Can you tell them where they can find you?
Yeah, so website is drkarawada.com. Also on YouTube, it's at Dr. Kara Wada. Put out a video once a week over on their range of topics. And then on Instagram is probably the place I'm most active, which is Immune Confident MD.
Excellent. Thank you so much.
Thanks so much.
Thank you, listeners and viewers, for tuning in. If you want to catch more episodes of Uncover Your Eyes, make sure to follow or subscribe on your favorite podcast platform and on YouTube. To learn more about me, follow me on Instagram at dr.Meenal Agarwal. Until next time, keep those eyes uncovered.